Bismillahirrahmanirrahim. This video is the 8th video in this series of acute and chronic inflammatory dermatosis, and in this video we will discuss granulomatous dermatitis. The granulomatous dermatitis is response to indigestible antigen, and it is characterized by localized collection of epithelioid macrophages. There can be presence of focal non-allergic response or allergic response in the sensitized pupil. The antigen can be exogenous or endogenous. The exogenous antigen can be substances that implanted accidentally into the skin, such as silicone in breast implants, while endogenous agents are keratin. Other causes of granulomatous dermatitis are mycobacterial and other infections, sarcoidosis, and granuloma annulare. The sarcoidosis is a systemic disease that may lead to skin lesion. This systemic disease is probably due to immunologic cause, and there is presence of classical epithelioid cells, and these epithelioid cells are there without any necrosis, and clinically there is presence of asymptomatic papule, plaques or nodules that are present in the dermis or in the subcutis. The dermal plaque may be annular, or those sometimes they involve the subcutis. They appear as irregular nodules. They may simulate a neoplasm if the condition is severe. Granuloma annulare is a benign self-limited disorder of unknown etiology, and it is characterized by palisading necrobiotic granulomas in the skin. These necrobiotic granulomas are also termed as collagenolytic granulomas, or these are non-infectious granuloma, and in this there is granulomatous infiltrate that is present around a central area of altered collagen and elastic fiber. The causes of these granuloma annulare may be insect bite, sun exposure, and viral infections, and the contributing antigen uh, can be the protein that are present in the saliva of the biting arthropods in case of insect bite, altered dermal collagen in case of sun exposure, and various viral antigen if the etiology is viral. The exact type of immune reaction is still not known exactly, but it is considered that both circulating immune complexes and cell mediated immunity may participate in the pathogenesis of the disease. The activated macrophages are responsible for the morphology, and these secrete lysosomal enzymes and cytokines, and these lysosomal enzymes and cytokines are responsible for the localized or focal degeneration of the collagen fibers that are responsible for necrobiosis. This photomicrograph is showing the morphological features of granuloma annulare. Here there is central acellular degenerated collagen and mucin, and this is present in the superficial to mid reticular dermis, and surrounding this acellular material there is palisading by the macrophages, and these all these macrophages are arranged in such a pattern that the long axis of the macrophages, the long axis of the nucleus of their macrophages, they are radiating outward. So this gross picture is exhibiting the classical lesion of granuloma annulare. There is a presence of this annular plaque on the dorsum of the right hand. The Age group for this granuloma annulare is children and young adult, and the commonly affected site is dorsum of hand and feet. The lesions are usually asymptomatic. They may be skin colored and erythematous annular plaques as seen in this picture. 15% of the cases of granuloma annulare are disseminated and they have got 10 or more lesions that involve trunk and neck. There are no medical consequences associated with this entity, and treatment is rarely required. If it is causing cosmetic disfigurement, the lesional injection of steroid is usually given.